So good evening, everybody. First, I apologize for my bad English and my terrible accent, and I hope you will understand me. So my name is Lynda Martin. Lynda Martin. I'm a dentist, a dental surgeon. I like to say that I am a specialist in general practice. Usually, general and specialist is not okay, but yeah, I like to say that. I'm not going to talk about myself today. I prefer to share with you my beliefs, what I believe in, what drives me on a daily basis, and what allows me to be more serene in my treatment choice. I call them my dogmas. But I think you know most of these contemporary principles. First of all, the therapeutic gradient. It means that each time we hesitate between two treatments, we must choose the one that is furthest to the left. That is to say, the one that is the least damaging to the tooth. We know that the less we touch the tooth, the better it is. Today, I'm going to talk to you about the overlay done in one time at the office. The second principle is this quote from Hippocrates. He said, primum non nocere. Indeed, every good dentist has taken an oath and must avoid harming the human body, including, of course, the tooth. You remember? This third principle is perhaps my favorite. Biomimicry. Do you know it? Is a practice that learns from and mimics the strategy found in nature to solve human design challenges and find hope. Thanks to Wikipedia. So more we mimic the nature, more respectful and efficient we are. So we must observe nature. If we try to imitate enamel, we will make ceramics, right? If we are trying to imitate dentin, we should insert composite. And in relation to this junction between enamel and dentin, it would be wonderful if an industry could develop the same functions for our bonding. Okay? Try to memorize this picture to understand how we are going to carry out our posterior aesthetic treatments. And the last, the one which makes you gain a little humility, I like the fact of contrasting what is contemporary with what is modern. Today, I'm going to show you things that I wouldn't have told you 5 years ago. And maybe in 5 years, I will tell you differently. Okay, so let's start with a little lexical point on forms of preparation. The butt joint is the easiest preparation to make since it's a completely flat preparation. The preparation that can be done for lingual surfaces or to treat erosion phenomena with overlay called tabletop. The ridge up. This preparation involves opening the onlay preparation to expose more enamel surfaces and make insertion of the restoration smoother. You know what's smooth? For example, in this case, for the restoration of a maxillary molar, it is common for the enamel bridge to be quite strong on the distal palatal cusp. It would be stupid to recover it. So we are going to open with a ridge up to allow a better bonding. It's okay? Now is the bevel. The bevel is definitely my favorite one. It consists of making an oval bevel in the shape of a rugby balloon. You see? Exactly like in this picture. Thanks to it, you will have a magnificent optical effect for your treatments. That's really, really a game changer. Moreover, you will be able to work in compression with the propagation of showing force in centripetal direction. This form of buccal or lingual preparation is great for all weak teeth, such as non-pulped teeth or teeth with cracks. You could also have slot, the typical preparation for the proximal cavities, as they are frequently found. I admit that they can be useful to ensure the correct position of the restoration. And finally, we can have the shouldering. This is the usual preparation we can have for a crown. We can find it in the buccal surface, particularly on the premolar, when the smile reveals the teeth, or when we have a cavity near the collar, or when there is a metallic coloring that we want to hide. And of course, we can mix all this form of preparation on the same tooth. Here we find at the number 1, the bevel. At the number 2, we can find a bud joint. And for the number 3, the ridge up. And we even have a shouldering here at the number 4. Right? Makes sense? To make these famous preparations, I composed a kit of dental burrs, especially for onlay, overlay, veneer lays. It is called Braze Static Kit, number 1. Braze means Bretagne, which is the most beautiful part of France, the one where I live. Back to our preparations. The most important question is to keep or to cover. To cover or not to cover? To keep or not to keep? That is the question, isn't it? And when I see this schema from Dietschy, which explains the loss of tooth strange, I realize that it's not necessary to make a crown when the tooth has not lost much of its periphery. You see? Even it's no longer purple tooth. You can see on the picture number 3. But when a cavity passes through it, mesial and distal, it is preferable to cover all the occlusal surface. To improve my decision, I use this instrument. It is a thickness compass. You can see how thick is the wall. The answer, therefore, depends on the thickness of the residual walls. If we have less than 1 millimeter, we cover. If we have more than 2 millimeters, we keep the wall. And several criteria can come into play if we are between 1 and 2. Is it a premolar or a molar? How is the occlusion? Is it a deep cavity? Is there a root canal treatment? Does supporting dentin persist? What's the color of the teeth? We will consider that the wall is fragile and therefore cover it if the teeth is a molar. If it's a guiding cusp, if the patient presents bruxism or clenching, if the cavity is deep, or if the tooth is non-pulped. If you don't have supporting dentin, it means no more junction between enamel and dentin. And if we have some dyschromia, like metallic coloring, just to improve color harmony of the restoration. You can't make gray crown, for example. So let me introduce to you Sophie. Sophie has a perfect mouth, okay? And this feeling is her only feeling. And we agree that it's a beautiful feeling, right? I know it is beautiful, Care, because I made it. I made it myself in 2015, okay? At that time, I took worse photos. So I made myself this wonderful composite. In all honesty, we can say that it's an honorable treatment, right? But that's how it is. Our composite restoration or aging. Positive point, I made it with rubber dam. So I consider that the dentin core is still available. So we prepare the teeth like at school, like an intact teeth. The first burr is for making trenches at a controlled height, thanks to the controlled penetration cutter, okay? Trenches. Then I use another burr to connect the trenches. Next, I go under the proximal contact points with a fine burr. It's a really important step, because if you stay in the middle of the contact point, you will not be able to be precise at the time to the impression, conventional impression or digital impression. For the technician, it will be difficult to isolate the die and then to design a restoration with an half contact. Next, you will have difficulties in setting up the rubber dam, and if the restoration is okay, it will be hard to remove the excess of the bonding material. So please, go below these proximal contact points, okay? Let's go on. Let's talk for a second about the rubber dam, because if isolation is not good for me, it would be perfect for the teeth. And okay, I have to assume I'm a pink lover. That's why you see a lot of pink in this presentation. You see, isolation for me is really essential. You cannot work peacefully, serenely, without the rubber dam. And I like to set it up from the beginning, especially if I have to make the IDS or the dentin core. What is IDS? IDS is for immediate dentin sealant or sealing. The aim is to immediately seal the dentinal tubuli with an adhesive resin before or after the preparation, but necessary before the impression. If the dentin is not properly sealed during the temporization phase, microorganisms can penetrate the dentin tubuli and create pulpal irritation or even post-operative sensitivities. The benefits are biological and mechanical protection of the pulp-dentin complex. IDS will reduce post-op sensitivities. You can do your eventual deep margin elevation, and you can save tissue by filling the undercuts with a composite. It calls the buildup, the dentin core, the buildup. You can do your buildup with either several fine layers of flowable composite or a stratification composite, cusp by cusp, or a bulk fill, or a fiber reinforced composite that must be systematically covered by a thin layer of flowable composite to protect the fibers. I hope you remember the picture for biomimicry, okay? Because it's exactly what we are talking about here. So let me show you some videos to explain how I work. And before you can find here the QR code to find the video in full. Is it okay? We can see the QR code or not? Yeah, maybe better. So first, we have the protocol. Wait. Oh, okay. Can you hear me? So protocol installation of the rubber dam. Placing it requires following case steps chronologically, checking the passage of the dental floss between the teeth. Maybe I can do it again. Checking the passage of the dental floss between the teeth. We have the validation of the choice of crampon, the clamp. It is supported on the tooth using 4 points around the teeth. Location of the position of the perforations on the dam according to the teeth to be isolated. You need at least 1 teeth distally and 2 teeth mesially from the molar in order to position a fairly extensive pleural dam, really ideal for impression. Installation of the rubber dam on the ring, so-called parachute technique. The thick floss push the dam into the interdental spaces proximal below the point of contact. Folding it before the second pass and then sliding it helps prevent the dam from shearing. Steadygum double ligatures, and the frame then allows them to be wedged. Tooth cleaning now. Before any therapeutic decision to restore or to prepare the tooth, we must observe the healthy tissue to be preserved. With the oral restoration removed, we observe here carious tissue, metallic discoloration, and mesodistal cracks. You see? The infected dentin is cured using a tungsten ball burr on a blue ring contra-angle to preserve the affected dentin. The cracks and the dentin tissue will be sandblasted with 27 micron alumina in order to clean the cracks as much as possible and to physically increase the bonding surface. The 35 orthophosphoric acid etches the dentin for 15 seconds. This time chemically increasing the bonding surface. It will be rinsed thoroughly, and then the dentin will be dry slightly. A cotton ball impregnated with aqueous chlorhexidine is placed in the cavity for 30 seconds. The moisture from the cotton will be removed by holding the pellet, so then the dentin is dry, but not dry out. The universal adhesive Beauty Bond Extreme is rubbered for 20 seconds on the dentin. Then the adhesive is blown gently, then vigorously, before being liqueur for 10 seconds. A veil of very fluid injectable composite, Beautyfill Flow Plus XFO3, is spread thinly over the entire dentin, then photopolymerized. All dentin tubules are now sealed. A dentin core, the buildup, is made with composite to restore the entire dentin portion. This step makes it possible to produce a biomimetic preparation. The composite replaces dentin because it's close to its mechanical properties. In addition, making the dentin core beforehand allows for less damage during the rest of the preparation stage. Allez, preparation for an overlay. The 1.5 mm controlled penetration burr guides the homothetic preparation of the occlusal surface on the buccal cups and the lingual cups. It has a green ring for 1.5. If we had used lithium disilicate for the restoration, we will use the yellow ring burr, which works 2 mm. The green ring filled burr, positioned horizontally, connect the marks made following the natural occlusal shapes of the tooth. The preparation must never stop at the point of the contact to avoid all the problems of impression. Exactly what I said. Yes. The flame burr prepares the mesial face by passing under the points of contact. A metal strip can protect the distal face of the premolar. The inlay-onlay cavity preparation burr with laser marking allows you to create a slot distally. There is some carious tissue here. A bevel burr prepares the external oval bevel on the vestibular side and on the linguine side. A red ring burr softens the preparation and also polishes the preparation. Polishing of the entire preparation will be completed with a composite polisher. This one. Yeah. It's really important to polish all your entire preparation. So now we are great for impression, right? And how we bond the restoration. Maybe I will surprise you, but I use now injectable composites. Yes, I use Beautifil Flow Plus X FOO. Okay, but why I use it? Because it's really easy to use. It's durable over time. This chameleon effect makes that I only use the A2 color. It's only light cure, so I can take my time to remove the excess. And it flows so well. It doesn't leak down. It doesn't run away. You know what I mean? It stays where you put it. And what's the material of the restoration? It's a Shofu Blocks HC. Yes, because when you polish this material, you will have a surface so soft that it looks like a pearl. A pearl. It looks like a teeth. I will show you that in these videos. Oh. No. I don't want the sound. Preparing the overlay consists of cutting the attachment with the red ring burr. Then Shofu's HC primer is applied to the intraoral surface, previously sandblasted with 15 micron aluminum. This primer will be blowed before bonding. Notice that the Beauty Bond Extreme adhesive could have been used as a primer, simplifying the protocol by reducing the number of steps. The preparation is also sandblasted with 50 micron alumina and orthophosphoric acid is applied to the dental preparation for 30 seconds. Then rinse thoroughly. Beauty Bond Extreme adhesive is rubbed vigorously over the entire preparation surface for 20 seconds. Then blow out strongly. Before light polymerizing, Teflon strips are placed on the adjacent teeth. And yeah, you can blow before bonding. We choose an injectable composite for bonding, Beautifil Flow Plus X FOO, for its physical properties, which will allow easy removal of excess. Look at that. You see? No running. It's so easy to remove this excess. You can see them. It's here. It's not running away. It stays here. So with a brush, you take it out. You remove all the excess. The element is photopolymerized under Abaddon glycerin gel. Photopolymerization should last more than 1 minute. And to polish and finish the joint, because the joint is the weak link in the tooth composite overlay triptych. It must therefore receive methodically polishing to age well and not become hollow over time. The joint is first polished with the one-step tungsten polishing buffing cutter. Then the super snap polishers will polish the composite joint, and make the overlay so shiny. The order of use of these polishers is black, then purple, then green, then pink. And the lattice will really give a pearly, shiny to the Shofu block. Yeah, you see? can appear. The Arkansas burr will be used before passing the entire preparation with diamond paste using a brush. The blade number 12, yes, make it possible to check the absence of excess proximally and to facilitate the removal of ligature left intentionally long. After removal of the dam, the occlusion and proximal contact point are checked. Yes. A little bit smoother. Proximal contact points. Yeah, that's right. I hope you enjoyed. Do you remember Sophie? Yes. Now we can move on to the photos bonding phase. I repeat the protocol. Sandblasting with 50 micron aluminium. Orthophosphoric acid. Adhesive, that is just after the acid. It's fine. Adhesive. Then Teflon strips before photopolymerization. You can see the primer and the Beauty Flow Plus XFOO. You can take a picture, you have the time, you can remove the excess, then polishing, and that's the end. I thank you for your attention. And of course, if you have any question, you can contact me by mail, by Instagram, by Facebook, how you want.